So we did an interim study specifically focused on people who have intellectual and developmental disabilities along with mental health conditions. So we were looking at the challenges that are unique to finding adequate treatment and care, and our caregivers trying to find help for their loved ones if they have crisis or before they have a crisis. Brought together mental health professionals, people from the broader community to try to understand how these issues intersect and try to make sure our systems are modernizing to understand what people need.
What happens next?
We're looking at what policies we can propose to move forward. So we're talking about things like improving the integrated care, making sure that primary care providers also have mental health components and providers that they can share. So someone can go to one place and get help from multiple needs.
Working with Senator Julia Kirt is always great. And what we worked on today was about intellectual developmental disabilities and a dual diagnosis with mental health. It's a struggle sometimes as a family member to figure out that next diagnosis, and today we got to hear about advocates that are struggling with mental health and have to have their caregivers or families help them access the care that they need. We also heard from great presenters today about some great things that are happening, but we still need to move towards that no wrong door, where anyone can access mental health by going to their primary care doctor or a psychologist or a counselor at school, and that these people may also have a developmental disability.
So how much is workforce and other barriers, stigma, all those things we talked about, how much is that holding the state back at this point?
Well, workforce and mental health is definitely holding us back, which is why we want to let the workforce we have know that you can take care of someone with an intellectual developmental disability if you focus on the diagnosis of depression or anxiety or grief, but they may need to ask for help or supports. And those are the kind of things that we need to let people be aware of.